Medical nanotechnology, revolutionizing ocular disorders treatment. Welcome to today's lecture on medical nanotechnology. In this session, we will explore the exciting field of nanotechnology and its role in the management of ocular disorders. Nanotechnology has emerged as a groundbreaking scientific discipline, offering immense potential in various domains of healthcare, particularly in eye diseases. Nanotechnology involves the manipulation of materials at the nanoscale, typically ranging from 1 to 100 nanometers. At this scale, the physical and chemical properties of materials exhibit novel and advantageous characteristics. These unique properties open up avenues for the development of innovative therapeutic and diagnostic strategies, leading to revolutionary breakthroughs in ocular disorders treatment. To understand the impact of nanotechnology in ocular disorders, we must first grasp the fundamentals of this field. Nanoparticles, the building blocks of nanotechnology, possess distinctive properties that make them well suited for ocular applications. Their small size allows for effective drug delivery to targeted tissues while minimizing systemic side effects. Additionally, their large surface area enhances active drug release, maximizing therapeutic benefits. Drug delivery plays a crucial role in ocular disorders treatment, and nanotechnology offers unparalleled advantages in this area. Nanoparticles can be functionalized with specific ligands or antibodies to facilitate targeted drug delivery to ocular tissues or cells affected by diseases such as age-related macular degeneration or glaucoma. This precise drug delivery mechanism enhances efficacy and reduces the required dosage, minimizing adverse effects. Early diagnosis and continuous monitoring are vital for successful management of ocular diseases. Nanosensors, with their high sensitivity and accurate detection capabilities, have revolutionized diagnostic approaches. These miniature devices can detect specific biomarkers in ocular fluids, such as tears or aqueous humor, providing real-time information about disease progression. This early detection enables timely intervention and personalized treatment plans. Ocular tissue engineering aims to restore visual function by replacing damaged or degenerated tissues. Nanomaterials, such as nanostructured scaffolds or hydrogels, offer a promising solution in this field. These scaffolds provide a three-dimensional environment that mimics the natural ocular tissue architecture, promoting cell adhesion, proliferation, and differentiation. This regenerative approach holds immense potential in restoring vision to those suffering from corneal or retinal diseases. Contact lenses are extensively used as vision correction devices, but their application extends beyond optical correction. Nanotechnology has revolutionized contact lens design, allowing for better comfort, enhanced oxygen permeability, and even drug delivery. Nanoparticles embedded in contact lenses can release therapeutic agents for more effective management of ocular conditions like dry eye syndrome or glaucoma. Retinal diseases, such as age-related macular degeneration and diabetic retinopathy, are complex conditions that can cause vision problems. Traditional methods of drug delivery face limitations in effectively treating these diseases. However, nanomedicine offers promising new approaches. One such approach involves using nanoparticles to encapsulate drugs, allowing for sustained release over time. This method surpasses barriers that hinder drug penetration and improves treatment outcomes. Nanomedicine techniques, like intravitreal injections or implants, provide targeted drug delivery and have the potential to preserve vision in patients with retinal diseases. While the potential of nanotechnology is immense, ensuring safety is paramount. Understanding the toxicity profile of nanoparticles is crucial for their successful utilization. Extensive research focuses on assessing the biological interactions, biocompatibility, and long-term effects of nanoparticles on ocular tissues. By comprehending the potential toxicological risks, scientists can develop safer nanomaterials for ocular applications. In the field of ocular disorders, nanostructured drug delivery systems have emerged as promising tools for efficient and targeted drug delivery. These systems, including nanoemulsions, nanoparticles, and nanomicelles, encapsulate drugs to enhance their stability and control their release kinetics. By precisely regulating drug release, these nanosystems can maximize therapeutic efficacy while minimizing adverse effects. The development and utilization of such advanced drug delivery systems have revolutionized the treatment of ocular disorders, leading to improved patient outcomes and enhanced quality of life. Selectivity in drug delivery is crucial to minimize off-target effects and maximize treatment efficiency. Nanomedicine provides versatile targeting strategies, such as active targeting using ligands or antibodies, or passive targeting exploiting enhanced permeability and retention effect in tumors. These strategies can be tailored to ocular disorders, enabling efficient drug delivery to specific tissues or cells for precise therapeutic interventions. Optic nerve damage is a serious condition that causes significant vision impairment. However, recent advancements in nanotechnology have provided promising solutions for regenerating the optic nerve. One potential approach involves using nanomaterial-based scaffolds, which can provide a supportive structure for nerve regrowth. Additionally, the use of nanotechnology allows for targeted delivery of growth factors and gene therapies, which can further enhance nerve regeneration. These exciting developments hold great potential for patients suffering from optic neuropathy or glaucoma, offering them renewed hope for improved vision. These nanoparticles can be functionalized with ligands that specifically bind to disease cells or biomarkers, allowing for precise localization and characterization of ocular diseases. Additionally, nanosensors can be utilized to detect and monitor changes in molecular markers associated with ocular disorders, providing valuable information for disease progression and treatment monitoring. Moreover, nanotechnology-based devices such as retinal prostheses and drug delivery systems have shown great potential in the treatment of ocular disorders. These devices can restore vision by stimulating retinal cells or deliver drugs directly to the affected area, minimizing systemic side effects. In conclusion, nanotechnology offers promising solutions for ocular imaging, diagnostics, and treatment. Its ability to enhance precision, sensitivity, and targeted therapy makes it a valuable tool in managing a wide range of ocular disorders. Genetic eye diseases impose significant challenges due to their underlying genetic mutations. Nanotechnology presents a promising avenue for gene therapy. Nanoparticles can deliver therapeutic genes directly to ocular cells, bypassing the blood-brain barrier. The development of gene editing tools like CRISPR-Cas9 further enhances the potential to correct genetic mutations responsible for conditions like retinitis pigmentosa or Leber congenital amaurosis. In conclusion, medical nanotechnology has revolutionized the field of ocular disorders treatment. The diverse applications, including targeted drug delivery, regenerative medicine, ophthalmic diagnostics, and gene therapy, hold tremendous promise for the future of eye healthcare. As we continue to unravel the intricacies of ocular disorders, nanotechnology will likely play a pivotal role in guiding us towards more effective, personalized, and safer treatment approaches.